Welcome to Aesthetic Masters, where we talk about all of your favourite procedures that most of the celebrities are doing at the moment. My name is Lucy and I'm the Senior Consultant at CoolSculpting Clinic. Today we're going to be discussing liposuction versus CoolSculpting. CoolSculpting is an FDA-approved non-invasive medical procedure. It doesn't include incisions. You are freezing the fat from the outside of the skin, so there's no cutting involved. So it's a very natural procedure. It's working with your body's own immune system and lymphatic system to drain and remove those dead cells. This is a procedure that is happening day in, day out within our bodies. Whenever we have a dead cell, the body attacks, your lymphatic system will pull it away. So it's very natural. In that sense, obviously, it's done gradually. So 25% fat reduction per treatment area allows the skin to mold back into place as well and doesn't create any sort of laxity. With CoolSculpting, there's very little downtime. I mean, generally we say there is no downtime with CoolSculpting, but of course, because we're actually killing fat cells off, we will do a massage after the treatment for several minutes as well. You will definitely experience a little bit of tenderness to the area, but this won't stop you from doing anything. There's no do's or don'ts. You don't need to avoid exercise or you don't need time off work. So it's a very convenient treatment with very little sort of aftercare procedure. On the other hand, however, liposuction is a very invasive medical treatment. It's carried out by a doctor who will of course make incisions into the skin. You've got chance of infection. You will definitely have a local or a general anaesthetic. Your medical is more important. It's very restrictive on who can and cannot have the surgery. Of course, after the treatment, you may need lymphatic drainage massages. You've got to go back up for checkups. You may even need antibiotics. You'll definitely need a period of time off of work as well. So you've got to account into the fact that there's a lot longer downtime to get the results that you're trying to achieve with liposuction versus CoolSculpting. The main misconception with CoolSculpting is a lot of clients think that with CoolSculpting they're going to lose weight, so if they step on the scales they'll go down. That's not going to happen. CoolSculpting is to sculpt the area, so it is killing off fat cells, but you're not going to get a dramatic weight loss with the procedure. Generally, CoolSculpting is for those people who want to tweak an area or aren't suitable for surgery and want to fit better into the clothes, they want to lose a couple of inches, or they want to change the silhouette. Because CoolSculpting is a non-surgical procedure, it doesn't come with surgical side effects. The side effects that you usually see from CoolSculpting is just things like bruising, swelling, slight inflammation to the area. You do feel a sting once the applicator comes off the skin, and the nerve endings obviously go from -11 degrees back to your body temperature. You may find a bit of soreness to the area for 1 to 2 weeks after, and then that's generally it. Liposuction is a lot riskier than CoolSculpting because it's a surgical procedure. So of course you're going through anesthesia as well, so you will have a downtime, you'll be quite sleepy, you may need someone to take you home from the procedure, you won't be able to drive, you may need time off work, so that could be costly in terms of having 1 to 2 weeks off work, maybe even longer than that if it's quite a strong procedure. In terms of side effects, of course, the skin is actually being broken, so you may be at risk of infection, you may need antibiotic courses, you may get discoloration from the incision wounds. If you're trying to decide whether liposuction or CoolSculpting is for you, the best thing to do is definitely have a consultation for both treatments. You know, sometimes when we've done a consultation for CoolSculpting, we've referred people to go and have surgical procedures instead. If someone has not actually got fat tissue, this does happen sometimes, it's fibrous tissue, or maybe they've had surgery previously and they could have scar tissue under the skin. In these instances, surgery would probably be the better option because CoolSculpting only destroys fat tissue, so it literally has to be fat tissue. If you're considering CoolSculpting or liposuction, definitely get in touch and have a consultation for CoolSculpting at our clinic. It's overseen by a doctor, it's a medical grade treatment, and it is the only FDA approved fat freezing treatment around. So come in, speak to us and have a consultation. We can assess you and we're very honest. We will let you know, obviously we'll break it down into costing and how long the time frame will be, etc. For more questions and more information, please get in touch via our website or book the free consultation via phone or face-to-face online.